Hi, today I want to talk about doing something just a little bit different. Last week I talked about hormones and menopause, and I thought I should backtrack just a little bit because I get a lot of questions from people concerning lab work and what I recommend for a basic lab setup for somebody that's coming in for functional medicine. So I'm going to title this talk today, Will Aging and the Initial Blood Test for Functional Medicine, for a functional medicine visit. And I'm going to break it up into women and men and what I would say is the most basic lab work. For the most part, you really should be able to get this lab work at a cash price for $150 or so. I think at my clinic, we can do this for somewhere around $120, so somewhere along those lines. So it shouldn't be overly expensive to get this lab work performed. And I'm not going to go over each specific lab values, as far as individually, but this is kind of the collective of what I generally would recommend. So for a woman, she comes in for her first visit for a consult. The initial lab work that I draw, I'm definitely going to do a CBC. I'm going to do a CMP, which is a comprehensive metabolic panel, which will give me all of her electrolytes as well as her liver enzymes. I want to do a serum iron and a ferritin level, which gives more of the storage form of iron. I catch a lot of low ferritin levels and low serum iron levels on females, and it's a big contributor in their fatigue. Next, this is my typical thyroid panel that I run, which is comprised of 5 different lab values. I want to see a TSH, I want to see a T4 level, a free T3 level, which is absolutely critical that you get a free T3 level, because that tells you more specifically how much thyroid you have that's working at the cellular level. So I think it's very critical to have that number. You can have an absolutely normal TSH, absolutely normal T4, and have a very low or abysmal free T3 and be very hypothyroid. I want to see a reverse T3, and I also want to see a TPO test done, which would show antibodies for Hashimoto's thyroiditis. So I think those are all very, very important. Next, I want to see a testosterone level in my females. I want to see an estradiol level. I want to see a follicle stimulating hormone also for our hormones. Now, for females, part of this issue with the estradiol is going to come down to, when do we test? And if you're still menstruating and you want to get very accurate levels, then you need to really test on certain days of your period. And the one thing that I would add onto this would be progesterone. Now, when we're running these tests, like I said, if you're having periods, generally estradiol peaks on around day 12 to 13. So if you're wanting to check estradiol specifically, you'll want to check that estradiol on day 12 or 13. Testosterone typically peaks on day 16 for females. Progesterone typically peaks somewhere around day 21, 22. So as you can see, it can make testing a little more challenging, and you need to know kind of where you're at. If you're postmenopausal or if you've had a hysterectomy, then it doesn't matter when you test, and you can test at any time. Finally, I definitely want to see a highly sensitive CRP, which is going to be a measure of inflammation. I also want to see a fasting insulin level. So this lab work needs to be fasting. A fasting insulin level, I think, is more important than a fasting glucose level that you get with your CMP. The fasting insulin level is really going to give you a lot of information as far as telling you how much insulin it's taking to give you whatever glucose you have on your CMP. So I think it's a critical test that should be run for everybody. Finally, running a cholesterol panel, for the most part, is not that useful to me. I think you need to really fractionate the cholesterol in a more specific manner, but that's a different lab panel that you run. But I do think a triglyceride to HDL ratio is actually a really good thing to look at, and I really like to see that below 2. So that's something that I'll use to, as we're trying to be more cost conscious with our patients on their initial visits. And this would be a very good comprehensive panel for a woman to begin with. Later we can add other specialty tests that I like, organic acids tests, stool tests, that sort of thing. But this is a great place to start for my female patients. All right, moving on. Now let's look at men. Men, pretty much the same as far as the lab work. I generally don't run a serum iron or ferritin level just because men typically aren't low, and we don't have the issue of having a menstrual cycle where we're losing blood every single month. So I generally don't run that particular test. I do a CBC, I do a CMP, I do a sex hormone binding globulin, which is an important protein to know because your testosterone is bound to sex hormone binding globulin and albumin to a degree. But this is an important number because the higher this is, when you calculate for free testosterone, you're going to have less free testosterone. So you may have a male with a testosterone of 400, but if he's got an SHBG of 80 or 90, his actual free testosterone is going to be low. So it's an important thing to look at. So SHBG, we're going to do the same 5 tests that I talked about earlier for thyroid. Very, very important that you run all of these tests. Otherwise, you really can't diagnose a thyroid patient adequately, in my opinion. So again, TSH, T4, free T3, reverse T3, and TPO for antibodies. Next, we need to get a testosterone level. And again, we talked about that with, and calculating that with the SHBG. I also want a highly sensitive CRP, again, for measuring inflammation. Insulin again, and then a triglyceride to HDL ratio. And again, I like to see that at 2 or below. So again, that's this is my starting point for all my patients from a functional medicine standpoint. And this gets us, like I said, gets us a good start. So if you like this video, give us a like, comment below, subscribe, hit the bell, and you'll get notified every time I put out a new video. I'm going to try to put out a video every Tuesday, and I'm really trying to get some information out there for everybody concerning functional medicine and health. And again, I'm Dr. Don Bonner. I'm at Personalized Wellness. We're in Ridgeland, Mississippi, and our phone number is 601-898-0911. Our website is www.thewelldoc, which is doc.com. That's our website. You can always go to there. But contact us. I'd be more than happy to talk to you. Comment below, and I'll do my best to answer all the comments. And I really appreciate you watching the video. And stay tuned. We'll have another one out next week. Thank you.